My name is Dr. Hopp, Robert Hopp. I'm a dermatologist here in Kennewick, Washington at the Center for Excellence in Dermatology. And I've created a video list of informational videos for my patients, covering subjects all the way from shave biopsies to melanoma to sunscreens and everything in between. They're short, informational videos of what I tell my patients, and their instructional drawings that I've included that I think help patients understand uh, the subject that's being talked about. So I would encourage you to take advantage of these.
This video is about compression on top of a surgical site or surgical wound after the procedure. Typically, after a surgical procedure, for example, an excision of a lesion and suturing, the first 24 hours are most important as far as bleeding and compression. Pressure on a wound will collapse the blood vessels and prevent bleeding, and that's why a dressing is applied over the top of the wound that applies pressure down on top of the wound to compress the vessels to keep them from bleeding. If one were to look at the side, from the side, the excision, and then with suturing, the wound, the areas compress with usually multiple layers of cotton gauze, which is held down tightly by flexible surgical tape, and that's left in place for 24 hours. This allows the blood vessels to form a clot and to prevent bleeding. In addition, resting the area and not using it actively, keeping this surgical compression dressing dry to prevent saturation of the cotton gauze. Once the cotton gauze becomes saturated, it loses its compression ability and also any ability to absorb blood. If one were to run into bleeding postoperatively, the simplest thing to do is to apply direct pressure over the top of the wound. So, with a gloved hand or a hand that's been washed or hand sanitizer applied, pressure can be supplemented down with a finger or fingers on top of the wound and held for 10 minutes. When the bleeding has subsided, then the pressure can be supplemented with an ACE wrap, Coban wrap, or even a simple towel wrapped tightly around the area to continue the pressure. So when it comes to post-op wound bleeding, pressure is the key to control, as well as not using the area and keeping it immobile.